Hey guys, welcome to another Ball Truth live hair transplant event. Today we have, I think, is a really special event because it's a pro bono hair transplant for a guy that uh, is a cancer survivor. The surgery is being performed by IHRS accepted member Dr. Sarah Wasserbauer, of course, and I think that we promoted a little bit, but not to the extent of really giving you a lot of insight about the patient. But she is performing, again, a pro bono FUE hair transplant for a very unique situation. Dr. Wasserbauer, how are you today?
I'm doing great. How are you guys doing?
We can't complain. Can't complain. Now, tell me about the patient. Tell me about, the patient situation and how you guys kind of hooked up for this pro bono procedure.
Absolutely. This is Carlos. And Carlos, you want to say hi? Hi.
Hey, Carlos.
So Carlos is a little muffled because he's face down. Carlos, and I'm just going to speak for you, buddy, just because we can't hear you as well. Came to me with a story of how he had cancer, a really rare brain cancer. It was diagnosed at age 18. He was within, moments in surgery and getting radiation therapy, so his entire life changed. He survived the cancer, and it's a really rare cancer, so that in itself is amazing. But he was left with, and I don't know if you can see it. I'll just point it out here. There's one spot, and I'm going to have you move to the side. There's another spot, two spots where the radiation beams kind of entered to kill the tumor, and then this big long scar right here. See there?
It's kind of hard to see because of the lighting right now, but maybe you can show it to us. Kind of move the light a little bit, and we might be able to see it better.
Can you see that a little bit better? I don't know if this is. It goes right here. And right now, of course, that we're doing surgery on either side. So anyway, it's always nice to get an opportunity like this where you can help somebody who, probably didn't think that they could do anything to help the hair.
Absolutely.
Because these areas are bare. We have pictures we can forward to you, and then you can see what it is exactly we're talking about.
And you guys could also go to California hairsurgeon.com, and you can see some images of Carlos on Dr. Wasserbauer's site right now.
And so what we're doing is we're taking hair from the areas of his head that were still perfectly, untouched, and we're going to fill in these little areas. The reason this one looks pink is because I've made a whole bunch of little sites where we're going to put the hair into, and the same thing with this big long scar. So that, he can just look a little bit more normal. When he goes out, he's got this circle here and this circle here and this long scar in between it. It just doesn't doesn't feel right to him walking around. People who don't know him don't know what the heck happened to the back of his head. So,
Well, let me ask you, when Carlos grows his hair out, I mean, because I'm looking at your website right now, it looks like he keeps a very short haircut to begin with. When he grows his hair out, was some of it covered to some extent, or was it just impossible to cover?
we have a picture from this morning. We had him grow his hair out for this surgery, and we'll upload that to the site too. It covered it a little bit better, but it's still pretty obvious.
Okay.
Unfortunately, I mean, nothing is hiding the scar because no hair is growing in the scar. But these two little patches where the radiation was, and sometimes radiation allows the hair to grow back, and sometimes radiation completely obliterates. It just depends how much radiation you're getting to that one little spot. So in his case, he's kind of halfway in between. It just looks odd.
Hey, Carlos, let me ask you, how has this, I mean, obviously you survived cancer at a very young age, and I'm so glad that you're here to tell us your story. How has the hair loss from the radiation treatment affected your life?
It just it's always been in the back of my mind. I see others with perfect. I almost envied friends and family that had just perfect
Backs of their head.
backs of their heads.
You can lift up your head, by the way, if you want to. I've stopped for a second.
Yeah, perfect backs of the heads, and I've always just kind of wanted to be normal. When I was diagnosed with the tumor, I was far from normal. My symptoms wouldn't allow me to do basic things. I had vertigo for a few years before my surgery, so
You had what? I'm sorry.
Vertigo, dizziness.
Vertical. Okay.
Really.
Yeah.
Yeah, and it was almost 24/7. So I got to a moment in my life where right before surgery, I kind of told my mom I was. I'd rather have the surgery go very well, or if it ended in, in the worst case scenario, death, I would be okay with that.
That's quite a point to be at.
Yeah.
Well, let me ask you this: if and I actually didn't hear the last the last sentence, so maybe you could repeat that, Dr. Wasserbauer.
He said that if he was at a point in his life right before the surgery where if it had gone really well or if the surgery had gone, as bad as it possibly could, he would have been fine either way because he was dealing with such terrible symptoms from the tumor.
Right.
Vertigo, you feel like the world is spinning, and I don't know if you can't stand that for very long, but that happened for him 24/7. He was just at
Yeah.
a point where he was just ready for that, to be resolved one way or the other.
Wow, that's pretty heavy. So let me ask you this. I mean, first of all, is there any male or female pattern hair loss in Carlos's family? Does he have any genetic hair loss?
Mom's side, right?
Right.
Mom's side. And his dad's side, it's not significant. He's noticed a little bit of temporal recession, and
Right.
that's something we discussed initially. Was if we take care to fill in these back areas, at some point in the future, you may want to do a surgery for hair transplant to improve things in the front, and you're limiting your supply. However, Carlos has a really nice donor supply. So I didn't think it would be too much of a problem. Plus, we also discussed preventative measures, Propecia, Rogaine, doing whatever he can to keep it to a minimum and accepting a little bit of maturity to his hairline so that, he doesn't have an unrealistic idea of what the future might hold.
How old is Carlos now?
26.
26.
26. So it's been 8 years since you were diagnosed, or 8 years since you had the radiation treatment.
It's been about 7 years since I've had radiation.
7 years since radiation.
8 years since surgery.
8 years since his surgery.
And I'm curious, what has life been like for the last 7 or 8 years? I mean, is it kind of like life plus at this point?
You can lift yourself up.
I'm very grateful for being alive and not having side effects. It's almost like I got a second chance in life.
Tell him about your little girl.
Yeah, I have a daughter. She was born in '09, and
Also tough.
Yeah.
and she's my world, and
She came to the consult, by the way. I think that's what convinced me.
yeah, and I love her to death, and she just made me appreciate my life a lot more.
Well, listen, this is really a touching story, and I'm so glad again that you're here to, be a part of this, and I'm so glad that you contacted Dr. Wasserbauer because listen, I think you're going to really come away with a great result. It doesn't seem like there's a lot of surface area there that really needs to be filled in, at least from what I can see, Dr. Wasserbauer.
So it's I'll get Eric back here to show you exactly where it is, but I'll turn it real. Can you see right here? It's about, I don't know where my ruler is. Grab me a ruler real quick. And I want to grab the webcam, but I'm afraid to. And just bring it over here to show you. There's about, let's see, 6 centimeters by 5 centimeter circle right here. There's a 3 centimeter by 1 centimeter scar right here. You can lay your head down. There you go. This scar is pretty long, but it goes all the way down his neck. So we're only filling into where the hairline really would be. But that scar is 8 centimeters long it's 3 inches and it's about centimeter and a half wide. Everything in hair is centimeters, by the way.
So how many grafts do you think you're going to need in total?
About 1,500 to fill them in. I mean, this one's 5 by 3 or 4. So they're pretty substantial. I mean, The one over here, it's like about from there forward on your hand. So, I mean, if you had a big area of the back of your head that wasn't filling in as much as you would like, about the size of half your hand, then you would want it filled in too, and you'd probably be pretty self-conscious.
Oh, absolutely. Listen, I have a spot in the back on the top of my head that I fill in with makeup. So I am self-conscious. I talk about it all the time. I have kind of like a quasi comb over going. But this is obviously a different situation.
Yeah, everybody worries about the front of their head or maybe the crown right up here, but don't even think that this back part could ever leave them.
So let me ask you a question. What kind of what are you using right now? Is that the safe system?
This is the safe system. I have used every FUE out there. This one just seemed, in particular, because I have to go in between this area and the scar. There's certain areas I want to take from, certain areas I don't. This system is a little bit easier for me to be more flexible about where exactly I'm taking. And plus, I can direct it a little bit better. You know, I would like to leave his sides as intact as possible, and I'm trying to decrease the amount of density right next to the area that has little density, because I know that even though I'm putting hair in here, the density isn't going to come up to what his normal density is. His normal density is like 70 or 80 follicular units per square centimeter.
Right.
And transplanting, I won't get near that. So, you know, bringing the density down very slightly by taking the grafts out next to it will help to even the whole thing out. And visually, that's what we're going for. So that's why I use the safe system. It's a little bit easier for me to be more flexible where exactly I needed to go. I mean, the robot would have been great on a head like this, but unfortunately, it doesn't do all that well around scar. He has a crease in the back here. Doesn't do all that well in the crease. And plus, you've got little grids. So, you know, it's tough to move inside of a grid and tell it exactly the density you want it to do. So this is just a little bit easier. I suppose you could use the NeoGraft as well, but in my particular case, I just prefer this particular one.
Well, in a unique case like this, and I'm usually not a huge fan of scalp micropigmentation, but I recently did a live event where I don't know if you know one of a pretty well-known forum user. He also works for Dr. Alan Feller. Guy's name is Specs. He had this temporary they claim it's temporary micropigmentation in his old strip hair transplant scar. Now, he doesn't wear his hair particularly short, but I will tell you this, that the results were pretty significant as far as camouflaging that scar to some degree. And what was unique about, or what's being claimed that's unique about this technique, it's that eventually the ink does fade. Not fade in color, but it's supposed to basically just disappear. So
Yeah.
that's kind of what attracted me to doing the live event because, again, I'm not a fan of the permanent scalp micropigmentation. But in a case like Carlos's, perhaps, if the density isn't what he wants, or if it doesn't achieve a complete and result, maybe going in there with some scalp micropigmentation could really help him out. What do you?
Yeah, and we actually just did. It's funny you should mention scalp micropigmentation. We actually just did an entire FUE on somebody who had had whole scalp permanent micropigmentation, but it just didn't. He liked the look of it, but having hair up there, when he'd let the rest of his hair grow out, it was pretty obvious that those were short and the other ones were long. So he
Right.
just wanted some fuzz. It didn't have to be dense because the color was there from the micropigmentation. The visual was already achieved, but he needed something to kind of make it look like it had some three-dimensional, appearance to it. So he came in and we did that just last week.
And what are,
So
what
now,
are your thoughts there? What are your general thoughts on scalp micropigmentation? Because I will tell you, there's a lot of guys going in for like this full Monty, where they just want to have this buzz look. But I will tell you that what I've seen in person, for the most part, it's kind of the creation of almost like a two-dimensional weird look to me. I don't know
yeah,
what
it's
you've
like
seen.
getting your eyebrows tattooed. I know people who've lost their eyebrows and they've gotten their eyebrows tattooed on, and that it looks good frontally. The problem is the three-dimensional aspect. So if you have I think in a limited area, and some people just buzz their hair short, and then the three-dimensional they don't care about that. So for those people, it's perfect. But I think people who have done their whole heads, who still have significant donor on the sides and the back, find that it's not quite perfect camouflage wise.
Right.
And so, to each their own. I think it's a nice low cost alternative for people who, would be buzzing their hair otherwise, but can't afford an FUE hair transplant. It's probably useful.
Yeah. And I
I
also
know,
like the idea, like I said, I was attracted to the idea of this temporary procedure that's being performed in Milan. And
right? Then you could try it.
yeah, I think that, yeah, I mean, you kind of have like a way out of the other side of the tunnel. If it doesn't work out in a couple of years, it's going to fade.
Yeah,
So,
and the only problem I would say with the micropigmentation only being your only option, if that's a permanent option, is that it's limiting. You're only going to be able to have short hair. Otherwise, it's really gonna. I mean, it's going to be obvious.
that's right. That's right. Listen, Dr. Wasserbauer, we have a phone call, so let's take some calls.
I'm gonna. You're gonna hear my whirring in the background. I'm gonna start again.
Okay.
So go
All
ahead.
right. And now are you going to be able to concentrate and take a couple of phone calls?
You should hear me sing. That's what I
Okay.
usually do.
All right. Let's see who this is.
If I can't, I will stop.
Hey, you're on the air. Who's this?
This is Mark. Hey, I was
Hey,
just
Mark.
wondering. What kind of people may not qualify for this kind of a surgery? I know that it's popular and all, but there's got to be some people out there probably that don't qualify. I was just interested to know who would not be ideal for this kind of a surgery.
That's a great question.
I would say number one, if you have an unrealistic idea of what it's going to do for you, you are not qualified. If you think that this is scarless, you're not qualified. There's going to be little tiny dot scars all over the place. For people who can't ever get away with shaving their head and have this is going to kind of look like road rash for about 10 days. So if you can't do that, yeah, it's not going to work for you. Curly hair is tough. I mean, my staff will tell you when we count every single graft, and curly hair has a much higher transection rate, almost to the unacceptable range. Sometimes curly hair works out fine, but I have to do a little test patch to see if it'll work. And if it's above 20 or 30%, you can find yourself another hair surgeon. I just won't do it because it just seems like it's robbing Peter to paint Paul. And those I'd say were the kind of the big ones. Sometimes people have a really tight scalp or a lot of scarring. That makes it difficult, but it still can be done.
So does that answer your question, man?
Oh yeah, absolutely. One little follow up to that: when you have to tell people that they don't qualify because maybe they do have curly hair, is it major disappointment? Do they feel like they've now exhausted all their options, or is there always some sort of alternative solution?
Usually they have the alternative of doing a regular traditional strip surgery. Your scars are so small, it is better when you can do the FUE. But my scars are particularly small when I do a strip surgery too, so you can't really. I think some people have this idea that all scars end up looking really fat. And these days it's just not the case. So I think when you show them the alternatives and what you would suggest for them and really why you don't want to kill half their hair, I think they kind of understand. Most people who can't do FUE can do something else.
I will say this: a lot of people are gravitating towards FUE, and I certainly understand, the reasoning behind it. But the truth is, and I don't know if you agree with this, Dr. Wasserbauer. We haven't spoken about this, or maybe we have, but I'm of the school of thought that really still believes that there's a real sweet spot that you can get out entire sweet spot of donor-resistant or DHT-resistant hair from the donor area with a traditional strip or traditional harvesting hair transplant that you really can't get with FUE. And I think that, if you need a lot of hair and if you have a really great donor area, I still think that there's a lot of room for strip, even though you can definitely see that the consumer, the hair loss consumer, the guys that are interested in getting surgical hair restoration are asking a lot more about FUE. It's being promoted a lot more, but I still think there is a huge space for strip.
Yeah, there. I've gotten several offers to be advertised in an in-flight magazine that shall remain unnamed. It's just basically advertising FUE, and it's advertising any doctor will pay him to say yeah, because the demand is there for FUE, but FUE is just one tool. It's one little piece of the puzzle, and it may not be the right thing for you, and that's why you need to see somebody who kind of knows what they're doing. I don't think it's a panacea. I think it's another one of those things we get so excited about stuff in hair, anything that's new, that we want it to work for us. And it sounds like such a promising thing, but it does get fewer grafts. I mean, you can see that we're going through a pretty wide range. Carlos actually has very, very nice donor. So this is not a particularly wide range for him, but it would be for somebody with class 6 hair loss would not be able to fill in the whole top of their head, but they might be able to with strip. So it has to be an individual decision, and based on what your hair loss prognosis is.
And I think that's important. That's important to say. And again, I repeat this all the time. And I have a lot of haters out there. They're like, oh, Coburn's just trying to hold on to the old school strip industry because he makes part of his living doing this. And what people don't realize is that I really was the guy that pushed FUE back from 1999. That had to convince, Bill Rassman and Bob Bernstein that this is something that is really a viable option when Ray Woods contacted me. But I never believed that it was something that was going to completely take over surgical hair restoration because every person is different. I just thought it would be a great adjunct initially. And for a lot of people, it's a standalone procedure. You don't really need to go in for that strip. But there are some guys who either through repair, the repair process, or just because they're not great candidates for FUE, that if they really want surgical hair restoration, that's really their only option. So it's not like strip is bad. Everyone has this thing, strip is bad, strip is bad. There's still room for strip, and it's still a great procedure if it's done correctly.
If it's done correctly, yeah, and that's a matter of training and all that. But I completely agree. If you have a high need for grafts, you can do FUE once or twice. When you get into third time, depending on how much donor area you have, you do start to run into that moth-eaten appearance, which to me, defeats the purpose of getting a micro scarred transplant in the first place, because if this area back here is going to look like it's not necessarily full, well then who cares about the top, right?
Also, what about the future of your hair loss? When you have a strip, and again, I'm the hugest proponent of FUE, but if you have FUE by someone who's extremely aggressive and they go into what's normally not the permanent zone, and you do progress in time. You see these guys who are, maybe they start losing hair when they're 25, 26 years old or younger. By the time they're my age, or by the time they're, whatever, in their 50s, they have like the donor rim of, it's like an inch thick in some cases. Yeah. Those are the rare cases. But if you get to that point where you are Norwood 7 and you're going into that area, I don't care how small the instrument is, there's going to be some visible scarring, or at the very least, you can never get sun on your scalp again.
Right. It's that moth-eaten appearance. I think people underestimate it. I've had somebody who came in. Somebody promised them they had about 3 inches worth of donor area. Somebody promised that they could get 5,000 grafts FUE in 2 surgeries, and I told them that's not the case. And they went with this other guy. More power to them, but. I think that there's a lot of promise and under delivery, and I worry about that because that's kind of characterized the hair industry for years. And I'd rather people know exactly what they're headed into before they make the decision to do it.
Well, that's the biggest issue that I have with the way some FUE is being marketed, and even the NeoGraft. And I've spoken to Dr. Alan Bauman about this at length, and he agrees. He's good at what he does because he is a hair surgeon. He's been doing this for a long time. So in his hands, in his staff's hands, the use of the NeoGraft works. It's a great tool for extracting grafts. However, some of these devices, including the NeoGraft, have been marketed to guys just getting into cosmetic surgery, or maybe plastic surgeons who want to expand their practice, or cosmetic surgeons who they're not plastic surgeons, but they just, maybe they're doing chin implants and boobs and stuff like that, and they just want to increase revenue. So, these products are being sold, and techs are going across the country on a per diem basis, performing the entire surgery for these doctors. Unwitting patients, or patients who are, they're entrusting these doctors because they're looking up their credentials, don't realize that the doctor's not the one who's even performing the surgery on them. That could set the industry back decades, in my opinion. And I've been talking about this for a long time, and I'm starting to see that happen. So it's a big issue. It's a big issue.
And that's the results from it, where people need to come into me and get their whatever work was done redone. And sometimes if you're in a position where you've destroyed some hair in the process because you just didn't know what you were doing, you're really up a creek, and your possibilities are limited. So I worry more about the patients than I do about the individual companies not making money. I like innovation, don't get me wrong, but I really want there to be options that are right and available for everybody, but done by the trained personnel who knows how to work with it.
Yeah, but the companies can make plenty of money as long as they're getting their equipment in the right hands, and eventually, maybe a little slower at first, but eventually, if it's done right, it's going to evolve relatively rapidly, and they're going to make plenty of money. But sadly, that's not the way some of these companies are marketing themselves. Listen, my sidekick, my engineer, and the guy who actually syndicates my broadcast and this broadcast across the entire internet, including iTunes Radio and Stitcher Radio and on the GFQ network, Andrew Zarian, has a question for you. He's become kind of like, I have to tell you, the guy's got great hair, but since he's been a part of the program, he's become really neurotic. Come on, you have, dude.
It's true.
You're 28 years old. You got the hair of a god. I mean, I listen. I can kind of understand it. I started losing my hair at a young age, so I know it's important to kind of get involved and see what's happening. And I always say early intervention is the key, but I think you're a little too worried about it at this point. I'll let you ask your question.
It's never too early, Spence. It's never too early.
No, but there's no reason to make yourself sick over it. I mean, this guy will Skype me at like 12 midnight my time, which is 3 in the morning on the East Coast, to ask me to look at his hairline.
No, that's happened, actually. Yeah, that is true.
I'm not even joking. I mean, I don't know if Dr. Wasserbauer can see your hair right now, but it's crazy. It's like you look like Eddie Munster.
Well, I hope it stays that way.
You're like a. I mean, you look like a good-looking magician.
Well, I actually have a question. People are sending me questions while we're doing this in the live chat room, and somebody asked, "How do you determine if someone is a candidate for strip or if someone is a candidate for FUE? And is there a fine line between the two? Or is there an option? Do you give them an option, or should people give them an option if they should get a strip procedure done or they should get FUE?"
I usually give them the option if they have the option. If they're really tightly curled, and I think that they need a lot more grafts than an FUE will be able to get for them, I usually be pretty honest up front. I find that my patients are happier when they have realistic expectations. A lot of it depends, number one, on their donor. So if they have really curly hair, it doesn't really work. And a lot depends on how much they need on top. If they have a big melon, but they only need frontal temporal, something up here, well, then you could probably do it. If they have a really small head, not a lot of donor area, and they need the whole top filled, well, then FUE is probably not going to be their best option.
How many grafts can they get? On average, how many grafts can they get with an FUE?
Roxana, what's the average for FUE? Anywhere between 1,500 and 2,400.
So between 1,500 and 2,400 is what we've gotten. I think we're averaging 18 or 19 right now.
Oh, we got cut by them.
All right. Well, obviously, we got cut off. Hopefully they will hook up. You can hook up with them right now. We have some calls on the line. So, guys, hold on. I'll take your calls when we hook back up with Dr. Wasserbauer. If you're just tuning in, we're doing a live hair transplant event with IAHS-accepted member Dr. Sarah Wasserbauer, who is performing an FUE hair transplant, actually a pro bono which means free, if you guys don't know what pro bono is. FUE hair transplant on a young guy who is a cancer survivor. He survived cancer for the last 8 years. I guess he's been in remission, and he had a very rare type of brain tumor, had significant radiation that left him with very distinct bald spots in the back of his scalp. Plus, he also has a very big scar in the center of the back of his head because obviously they went in there and they cut the brain tumor out. Luckily, he's alive to talk about it, but it really does show the emotional aspect of hair loss, because this is a guy that survived cancer. This is a guy that is living what I call life plus. He's got a family. He is a guy that should not have been around right now. And even before before he had the procedure, he was suffering a lot as a kid with severe vertigo to the point where he couldn't even do anything. I have a little vertigo. So I know what dizziness can kind of be. It's pretty rare when I get it, though. And it may have something to do with alcohol between me and you. But anyway, so I know what the dizziness is like. And that's not easy.
But it is fascinating that people, with FUE. Oh, we lost them again. I think they're back. Trying to get the video. It is interesting with FUE, it's less invasive, but it is less grafts. But what do you pick as a patient?
Well, this is what's interesting. I'll tell you the way it's being sold. There are guys out there that are diehard FUE guys. And let me tell you something. I am a diehard FUE guy. I love the procedure. I think it's a great procedure. And I'm not saying this to pat myself on the back, but I really pushed for this procedure to evolve here in the United States when nobody thought that it was something worth even trying. And because of that push, the first paper here was written by Rasman and Bernstein, and guys like John Cole and Alan Feller picked up the ball, ran with it, and helped to evolve this technique, which is now something that most hair transplant surgeons at least have in their tool belts. Some guys are converting completely. Now, as far as the complete conversion, I'm not sure if it's partly because of consumer demand and marketing, or if in fact these physicians truly believe that it is a superior procedure. But in my mind, as a layman, but as an expert in this field, I really think that you need both procedures in order to get the most bang for your buck, so to speak. And if you really are a guy with limited donor hair, and you really are a guy that needs to get just that sweet spot out, I don't care what any doctor tells me, and I've been corrected by some doctors, or contradicted, I should say, by some doctors who I really respect. I don't believe you can get as many grafts in total out using FUE safely as you can using a combination of strip and FUE. But with that said, if you don't want a scar in the back of your head, then don't have a traditional strip transplant, but realize that you may get a great looking hair transplant, but you probably, if you need more grafts, you probably are limiting yourself a little bit more than you would if you decided to have a strip plus an FUE. If you choose
Can you
to
hear
have
us?
Yeah, I can.
I just wanted to make sure that we remade the connection.
Yeah, we're there. So can you pot up her video?
Yep, she's up.
All right. So listen, Dr. Wasserbauer, we have another phone call. Did you finish your question, Andrew? I know you got more.
Yeah, but it kind of goes into this. If the linear scar is not awful, what other incentive is there for FUE? If the doctor could do a strip procedure without having having minimum linear scar in the back.
There might not be an incentive for FUE. Spencer, you said something a little bit incorrect. If a patient wants to not have any scar, then they shouldn't do any surgery. Anytime you make any incision in the body, you have a scar.
You're right. I actually meant a linear scar.
If you calculate the amount of area, do you remember the formula for the area of a circle? I do. It's pi r squared. If you calculate 1 millimeter, for 1,500 of these little guys, and then the length of a traditional scar, maybe 22 centimeters, but it's only by 0.1,
right.
Millimeter. You have a hell of a lot less scar with a traditional strip surgery. So yeah, I think you have to give patients both options. Realize that there's a lot of hype out there, but it might not fit their particular case.
And you're right about that. I actually had a conversation this week or last week with Bob Bernstein about that, and he told me to take a look at his website, and he did the calculations as well. And he said that's something that patients don't really understand. That in time, the more FUEs you have, you're going to have, it could eventually end up being kind of like a confluence of scarring if you're having too many grafts extracted, which could be a problem in itself. But you're right. As far as the surface area, there's a lot more scar tissue. No matter how small the grafts are, no matter how small the tools are, people need to understand that. That's not to say that for the right case, for the right patient who may only end up being, genetically a Norwood 5, who has a really high donor rim, really great donor area, and that may extend a little further than somebody who has a more aggressive type of hair loss, then a straight FUE could be perfect. But you're right. I'm glad you corrected me. I actually meant to say linear scar, not scar in general.
No, I figured you did.
So let's take a phone call. Hey, you're on the air. Who's this?
Hey, Spencer. This is Vic from DC.
Hey, Vic. What's happening, man? What can I do for you?
Hey, I'm just tuning in to the live broadcast. I think the feed is amazing, and
oh, thanks, man.
This is really, really cutting edge because I mean, how many people get to see, live FUE happening?
Well, I can tell you this. Since you mentioned the feed, I have to thank my guy Andrew Zarian, GFQ Network, for really showing the bald truth how to do it right. It's a very unique thing that we're able to do. There's not a company out there that I'm aware of that's able to do full HD the way that we are utilizing Skype and get directly into the physician's office. So I got to hand it to Andrew Zarian for jerry-rigging the whole thing.
Well, thank you, Andrew Zarian. I appreciate that. So I got a couple questions. Basically, so ethnically, I'm like pretty much you could think like basically the same skin tone as Brazilian.
Okay.
It's like brown, but it's not like as dark as It's not black. It's not white. It's pretty brown. And
so it's like a dark Asian.
Yeah, exactly, a dark Asian.
All right.
And so I've been thinking, I need to get some work done. I need some hair. So I usually cut my hair down like to about a number 2. So strip kind of is like out of question for me. And my question is that if I decide to go FUE route, am I a worse candidate because of my skin tone?
That's actually a really great question. Dr. Wasserbauer, did you hear that?
Yeah, I did. Let me get it right. Your skin tone matches your hair color?
I'm sorry?
Your skin tone pretty much matches your hair color?
2, 2, 3, 3.
Unfortunately, it doesn't. It's my hair color is like pure black, and
and his skin tone, his skin tone is basically tan. He's like a dark Asian or like Brazilian type of skin. He said.
Okay.
Yeah.
So then, when you've got hair that's that dark, and FUE is probably a little bit better. Anytime you have any kind of scar on your scalp, it's going to show through that hair. I mean, like you mentioned, if you buzz it down to a 2, you're going to be able to see even these faint dots, and nobody will probably know what they are because they're diffuse. They're not really obvious. If you were to really, bick your head, yeah, you can see little white dots. But that would probably be a little easier. Now, have you ever grown your hair a little bit longer? Because your priorities might change a little later.
I'm sorry, I really can't. I couldn't understand your last sentence.
Well, she asked if you. First of all, she said that in your particular circumstance, having a strip scar with dark hair might be more obvious, especially if you cut your hair relatively short. As far as the FUE, because it's kind of like not in one particular place. It's not going to be as obvious. But if you do cut your hair very, very short, and in my view, if you have very dark skin, I think that FUE scarring will show up a little bit more, be a little more prominent, especially if you're going to shave your head very close to a number one or even down to the bone. So,
Or
you know,
you're gonna get a tan because those little white scars don't tan. Some people think, oh, I'll just tan, it'll be fine. But if you have a
right.
little bit of scar, it doesn't tan.
Yeah, and
Oh,
I
okay.
try to explain that to people all the time. You know, they think, well, I can just shave my head down, but as soon as your head gets a little sun, you know,
Bam, you can see all those little white dots.
and
It's
if you
not
don't
it's
to
not
begin
a
with,
perfect system, but it's very, very good. I doubt anybody would know what those little white dots are. I think it would probably look really invisible. But if you're like hypersensitized to it, you got to realize that that's, you got to figure out where your line is. What you can tolerate.
now how short do you wear your hair right now?
There's a number 2 on the back and sides.
Now, how old are you?
27.
All right, so I mean, it is possible that when you get a little older, you might consider, like Dr. Wasserbauer suggested, maybe you're going to change your priorities, and maybe you're going to grow your hair a little bit longer, and longer hair is in again. It took me 30 years to finally get my style. My style is back in style now, but it is
Yeah.
kind of back into some degree. So, I don't know if that's something you'd consider. If you really want a hair transplant, you might want to consider, well, you know what, there's a possibility I may have to grow my hair out a little longer. Is that something you can deal with?
I would certainly be open to that because the reason I cut it so short now is because I've lost a lot on the top, and it
That's
just
what
looks.
a lot of guys tell me. I was about
Yeah.
to I was about to ask that.
So, I mean, I got the swoop thing going, but I'm 47 years old, so for me, it's okay. But if you're 26, you probably want to kind of be a little bit more with the trends. So there's a lot of guys who will change their hairstyle according to what's happening this year in, the hair trends. If you're not that type of guy and you're willing to commit to kind of like something relatively standard for you that makes you look good, then I think you have more options, especially if you're willing to grow your hair a little longer.
Well, I hope so, Spencer, because like you said, I mean, it has a psychological effect. So
It has a huge psychological. I wouldn't be doing what I'm doing and doing it, for the last 15 years if it didn't totally F me up, especially when it started.
Well, Spence, let me ask the caller this question. At what age did you start seeing a change, and when did it start bothering you and affecting you?
So I started seeing hair in the shower when I was 18, but it only started thinning out like when I was 21, and so it's been happening for about I'd say almost 10 years now.
Yeah, I mean that's young. I mean that's really young for it to start. I asked that question because I recently, I actually yesterday I had dinner with a family friend, and they've had multiple FUEs. I think they've had 2 FUEs and 1 strip procedure. And the strip procedure that he got, unfortunately, it was not good. The doctor did not. There was a whole issue with it. There were complications. The FUE procedures that he got done were great, but he said that he goes through these cycles where at points he is fine and he's adjusted to it and he understands what's happened, and he almost is at peace with it. And in a couple of months, maybe he'll look at himself in the mirror and he'll get a glimpse, and it starts all over again for him.
It's interesting that you say that. And by the way, Andrew, I lowered my my Skype a little bit. He said it was a little distorted. I don't know if that's any better.
Okay.
But you had texted me last night, and you said that you're at your whatever your game night, drinking with your friends, whatever it is, and your family, and you met somebody that had this done.
Yes, and he's actually before he went and got anything done, he bought your book, and that's how the conversation started.
Yeah, that's what always freaks me out. I never liked that. And he's probably asking a lot of personal questions.
I actually did an entire show with him. I just sat there and repeated everything you've ever said on your show.
Well, so anyway, he ended up going to an IHRS doctor who had a good result, but he was a severe Norwood. This guy was really, really significantly bald. Right?
Well, it depends on what at what age, because he had his first procedure done, I believe, when he was 18, 19. And the first time he got it done, you know, when you look at him.
There's no way he could have bought my book for the first procedure. He must have bought my book after he had the first procedure.
No, he bought it after. Yeah.
You're 18, man. Tell that surgeon to stop doing surgery on kids unless they've got a realistic idea what's going to happen.
Yeah, well, if he bought my book, he definitely wouldn't have had the procedure at 18.
Well, no. What year did the book come out?
It came out in '98, but he probably bought the book afterwards, after he screwed up, you know, because there's no way that he had a great procedure.
Well, he's a couple years older than me. He's not an older guy by any means.
Right.
So, you know, he got the procedure done, and he said the problem was that he knew when he was sitting there with the doctor that something was fishy, but he just felt that he had to do it. It was an impulsive act to do it to save his hair.
Well, what was fishy? And by the way, I'm sorry. What's the caller's name? What's your name again?
Vic.
Vic. I mean, I'm sorry. I don't mean to cut you off. Did you want to have it? Did you have any more questions before we go on?
I had just one more question for Sarah.
Okay.
I was like, so I'm not worried. Like, for example, if I were to get a body hair transplant, a BHT, I'm not worried about scarring on my chest or legs, and I was wondering if Dr. Sarah Wasserbauer does BHTs.
Yeah, I do. And you know what? I was going to mention that earlier. Hold on, let me get this graph.
Oh, that's awesome. So, just real quick, what from the research I've done, most of the results are not on par with taking it from the back of the head. But I mean, what do you feel, Dr. Sarah?
If you are relying on body hair transplant to fill in when you run out of donor from FUE, it might not be a certain plan B. So what you might want to do, this is what I do for all my body hair transplant patients. Every single one of them comes in. We just charge for the OR and we try it and we see what grows. And that's really eye-opening, I think, for a lot of patients because you don't get as high of a yield. Yield is how many you get out when you attempt to get a hair out. And you also don't get as high a survival rate. So that's once it's implanted, how many of them grow. So it's not one-to-one. Scalp hair is really unique in that aspect. It's one of the reasons we use scalp hair to transplant within the scalp. I had somebody ask me if I could use toe hair for their eyebrows because they liked the look of it and it was the right length. Yeah, you could, but that's not necessarily going to grow and you may not necessarily be able to get it out. Okay, that's a weird example, but the fact of the matter is body hair is not always going to give you, I would have to look at your body hair and we'd have to do a trial surgery, see how much of it grew. If only 60% of it grows, well, you might take that under advisement and decide that it's just not worth going through the procedure for you, whether or not you care about scarring on your body.
But also, man, you already have dark skin, you're telling me. So, I mean, the scars, even if you're not in the sun, they're going to be a little bit more apparent on a guy with darker skin.
Right.
So that's something that you have to take into consideration. I've seen body hair work, and there's a couple of guys on Bald Truth Talk message forums that have had pretty good results from body hair with what I would consider to be limited scarring. However, it's such a crapshoot, and especially if you need a lot of body hair. I mean, I know one guy who spent $100,000 with a guy here in the Los Angeles area. I'm not going to be specific. And he had a miserable outcome. I mean, total disaster. And this particular doctor promotes body hair transplant as basically that's his thing. That's his niche, you know, body hair transplantation. So, you know, I've seen some okay results, but for the most part, man, I think it's kind of like I think it should be reserved. And again, Dr. Wasserbauer, you know, you can correct me if you think I'm wrong, but I think it should be reserved for the really desperate patient, the guys that have been so stripped out and so FUE'd out and so scarred up that they have no choice but to use this. And maybe in some cases, if they have a lot of body hair, it can kind of be like tested in certain areas, but I'm just not a fan. I'm just not a fan of it. And again, I'm a layman, but from what I've seen, you have to understand that I'm like the clearinghouse for complaints. So I see all the crap. I see all the bad stuff.
I'm the one that the hair doctors who screw up send their reconstructive cases to. So I see a lot of older work, a lot of botched work, a lot of yeah, a lot of body hair that hasn't necessarily worked. Now, that's not to say that there haven't been slam dunks with body hair. If you got the right combination, great. But I think you need to test it first. I think it's one of those things that, you know, the planets might not line up for you. So don't count on it until you get a surgeon in there who knows what they're doing and who tries it with you. And you know, that 6-month investment of time is going to save you a lot of money and heartache down the road if it doesn't work.
Did that answer your questions?
Yeah, that's great advice. I mean, I really appreciate you giving me a chance to ask these questions.
All right, man. Well, listen, good luck. And, you know, just please just continue to do your due diligence. Don't jump into anything. You're a young guy. And, you know, I mean, listen, I always say this. You haven't had anything done yet. You still have the option to shave your head. So, you know, you can consider that too. Hair transplantation is always going to be here. So there's no rush. You know what I'm saying?
Well, I gotta say thank you, Spencer. And before I leave, I just gotta say, I mean, your website is really, like, you're doing one of the best things for humanity possible. And I mean, I don't think Joe from Staten Island is crazy when he says you're a hero. You really are. So thank you so much for everything.
Well, man, I'm humbled. I really appreciate that, man. Good luck.
All right, thank you so much.
All right, let me give out the phone number. It's 888-659-3727. I want you guys to feel free to call in to ask Dr. Sarah Wasserbauer any questions about what she's doing right now as far as her pro bono FUE procedure that she's performing on Carlos. If you have any other hair loss questions, I know it's like, you know, I mean, it's not even noon here on the West Coast. So you guys are probably watching at work and it's hard for you to call in, but feel free to call in. Know that this show is going to be archived as well. And perhaps I'll have Dr. Wasserbauer at some point on the program so that you guys can call in and, you know, ask her some questions about, you know, what she does and about, you know, Carlos's procedure. And what I like to do, Dr. Wasserbauer, is, you know, in time when Carlos is, you know, recovered, and I mean, it's a very short recovery time, but when he starts to see some results, I'd love to have both of you on the program to talk about it.
Yeah, I think, and Carlos is really interested. I mean, with all the guys been through, Carlos is kind of waking up now, but he's, you know, in and out. Really interested in paying it forward, and, you know, making sure that people know that this can be done, whether their situation is like his, with, you know, we've got scars from a brain tumor, or whether it's a little less, you know, dramatic than that. I think he's really interested in helping other people to, you know, see what's possible and make good decisions.
I think that's great, and we really appreciate it. And I think Andrew's waking up now too.
I've been up.
Oh, okay.
Yeah, took a little nap. That's fine. No, I'm actually getting a lot of messages, so I'm just filtering through some of the messages that people are sending us.
And by the way, just to let you know, you guys are, I mean, I know that you're Skyping me too. I got so many things going on here, running my board, taking the calls, you know, speaking to Dr. Wasserbauer. You know, Andrew's the one that you want to contact so that he could actually read the messages and read them to us. So I'm apologizing if I'm ignoring your IMs, but I just can't, you know, handle everything at once.
One of the questions that we constantly get.
Stop stressed out today, Andrew. I don't know.
It's all right. It's all right, Spence. It's all right. I'll read the questions. One of the questions that we constantly get is the mental state that people are in prior and post. And people want to know, and I ask this question whenever we do one of these procedures. Do you see a change in their personality? Do you see people that walk in with high expectations that will never be realistic? How do you deal with that? The psychological aspect of, you know, getting the hair procedure done. What is that like, and what do you recommend people? I mean, one of the questions, one time somebody said, you know, maybe it might be good that people go to therapy before and after to kind of give them the understanding of what's happening if the procedure is not to their expectations, how they could react to it, or if it is, they could still, you know, be overwhelmed by this.
Well, before Dr. Wasserbauer answers the question, I hope this isn't insulting to you, Dr. Wasserbauer, because you are a professional and everything, but there's someone in our chat room that keeps wanting us to say how hot he thinks you are. We normally don't get that, you know, in these procedures. So I thought that was pretty interesting.
That's really sweet, though. Thank you very much.
Sure.
The funny thing about that is my husband is running the camera, so That's even funnier.
It's all right. The same person, by the way, said that I look like a male model.
Oh, good.
Well,
yeah.
My husband is typing those in, isn't he? There for a little while. So with regards to the emotional aspect, this is actually when I did a fellowship with Matt Levitt, who did MHR, which is now defunct. My project was the psychology of hair loss, and it's way more psychologically important than people give it credit for. I'm fond of saying that it's not vanity, it's dignity, and I really do believe that. How you perceive yourself not only has to do with the picture, but also the frame. And by the picture, I mean your face, and the frame, I mean how your hair is framing your face. So I'd say that sometimes I do a lot more counseling. I definitely, if somebody comes in with these really high expectations, that's a red flag. And it should be for any surgeon out there who's doing hair, whether they're doing hair exclusively or they're a plastics guy you're a derm who's just doing it once a month. If you have a patient who has this idea that you're gonna, I don't know, get them a girlfriend and they're gonna be wealthy and get promoted when they get their hair transplanted, and it's gonna look as thick as a wall of hair and they're gonna look like Andy Garcia with that little V. No, it's not gonna happen that way. And so what you do is you start slowly and gently and you're very, very, very honest. That's tough, I think, especially because some hair surgeons out there are hungry, in the sense that they like to do surgery, they want to do surgery. When you have a hammer, every problem looks like a nail. Every patient looks like, I could do a little surgery on this patient, but you have to be very judicious because it is so emotionally ingrained, and not just in women or in men. I mean, I think everybody who has hair. I got this question one time. Somebody said, "What's the big deal about hair and hair loss?" You look at this person who was asked the question; they had tons of hair. The only person who would ask that kind of question would be somebody who hadn't lost their hair. I mean, you don't ask that question unless you've gone through it. It's just, if you've gone through it,
And that's exactly right. And there's a lot of, I hear this, I've been doing this for a long time. And when people find out what I do, if I'm in a social setting, if we're out at a party, whatever it is, I actually cringe when people either know what I do or ask me what I do. Because I don't want to lie about what I do. But as soon as I start to talk about what I do, either I end up holding court, or all the wives of the guys are like, "What's the big deal? I think my husband looks great," whatever it is. But meanwhile, the husbands are, they start to open up and say, well, she has no idea what it's like, what I have to deal with. And every once in a while, there's that woman that you see in the gathering who is dealing with hair loss, who's very quiet about it. And none of her friends can understand it. None of her contemporaries can understand it. But unless you're going through it, it is so devastating, male or female. And you know what? I don't mean to cut you off, but, women, it's always like, well, it's acceptable for men to have hair loss. It may be acceptable. It may be socially acceptable. It still doesn't mean that we don't think our looks are eroding and our self-esteem is eroding along with our hairline. So it's still very painful, even though it's socially acceptable.
It's I keep a lot of tissues in my consult room. Because I think people have it bottled up for so long that when they finally get to somebody who they think can understand them, they're in a private environment, it's just like, oh gosh. And you gotta feel for those people. That's why I get so upset when, somebody comes in with a botched job, because, you're vulnerable and then you're taken advantage of. So I think that's another reason why if somebody comes in with unrealistic expectations, like, you gotta handle them with kid gloves and really help to bring them around.
Well, that's the sad part about this industry. And no matter how much the industry has evolved, and I've used this word like 4 times during the broadcast, but, no matter how far we've come, and no matter how hard I've worked to make things, to push change, and no matter how far doctors like yourself have helped in this evolution, there's still the guys that, for whatever reason, they don't want to change the infrastructure of their practice. They're old school. They've been doing it for a long time. They think that the way that they're doing it is the way to do it because, you know what? It sent their kids, they were able to send their kids to private school and college, and they were able to pay their bills, and their patients were relatively happy. But what a lot of these guys don't understand is, until relatively recently, patients weren't really coming out to complain a lot because, there's this, there's a lot of psychological factors involved. But one factor is, when something happens in a situation where a patient entrusts a physician, especially when it comes to cosmetic surgery, sometimes the patient feels, especially a guy with hair loss, feels like, well, it's kind of my fault. I jumped into it. This is the best the doctor can do. I should have done more research. I can't blame the doctor for it. When in fact, if they really did do more research, they would have found somebody to get them to where they needed to be. And I guess the problem is I'm still getting resistance. I'm still getting the emails. I'm still getting the doctors who are actually bashing me publicly for just spreading the word. And I am sure that, behind the scenes, even though at the ISHRS conferences, everybody's buddy, there's a lot of, I think, a lot of concern for some of the more vocal physicians who are telling the truth out there and saying, you know what, there's a lot of bad work being done out there. Be careful. Surgery isn't for everybody. And I don't know if you ever have to deal with that, but I've spoken to some of our IHRS members who will tell me, and one very outspoken guy is Alan Feller, who will tell me that, he gets shit for telling the truth.
Yeah,
So I don't,
one of the stories I like to tell is back in the day when, this is not a dig on Bosley, but back in the day, it was a Bosley guy who was telling me the story. So this is back in the day when plugs were being done. And it was revolutionary for a guy to be able to have hair on the front of his head again when he never did. Now the plugs did not look great, but people were thrilled. They were, sending gifts to the doctor. You saved my life. I'm so pleased to have hair on the front of my head again. I mean, and this was what we would consider suboptimal improvement. But people were just so thrilled to have hair on the front of their heads again that they just didn't care. So that just shows you the depth of emotionality that can be attached to hair loss. Okay.
that's right.
I'm sorry. So what we're doing in the background, you might be hearing my staff, saying numbers out loud. They're counting every single graft under.
Oh, no, that's good. That's fine.
And so they were just kind of showing me where we're at. And so when people get into this, yeah, I think you need to have truth tellers. I think you need to bring patients sometimes back down to earth. Otherwise, they're going to be very unhappy and betrayed. So you can't betray their trust as a doctor.
Well, and I appreciate that, and that's really the way that it should be. But sadly, I wouldn't be in business if that was the case for most, for the majority of the industry. Now things have gotten a lot better, but there's no way I'd be on the air for 14 years. There's no way that we would have, gotten so many books out to so many people over the years in five or six countries. And there's no way that, an organization like the IHRS would even be needed or necessary.
Well, the good news is those old guys who are doing it, and I'm saying guys because I just don't know any old women who are doing this. But they're all retiring, and the level is coming up. I mean, there's really a lot more honest folks out there. And when you're a patient, go with your gut. Try really hard not to let the emotions sway you, but find somebody who you can have a long-term relationship, because your hair loss is not going to stop. So you need somebody who, let's say 10 or 20 years down the line, you need something else who's going to partner with you, who's going to, hold your hand through the whole process, because it is emotionally very difficult. I was going to be an oncologist. I was going to be a cancer doctor. So, I like that one-on-one with my patients. So this is a little bit like that. I get to have those long relationships with my patients. I really enjoy that.
Well, I have this question. Why do you think these bad procedures, quote unquote, are still happening with so many great resources out there? How is it happening, and how are people, how are the doctors, I guess, staying in business if there's so many good doctors out there nowadays?
Well, that's a good question. I'm going to let Dr. Wasserbauer answer that. But I mean, from hair loss, it's like 200,000 of us waking up every day in the United States realizing for the first time that we're losing our hair. And usually, I mean, obviously the internet is incredibly powerful, but with all the empowering information that's online, there's still so much crap. So, and I always say this on the show, and you know this, Andrew, when you look at hair loss treatments, or if you look up hair transplant surgeons, you're going to find, the IHRS or American Hair Loss Association or one of our resources in the top 10 of every Google search. But there will be plenty of people who would just go past our resources because they want to get something done right away. They want to either buy some, bullshit product or service, or they want to, jump on the bandwagon and say, what, I've heard of this company, on the radio, or I've heard of this company through infomercials. Let me go to them first. And sadly, then they kind of, after they make the mistake, they kind of, circle back around and use our resources. Now, there are plenty of lucky people that find our resources first, but, people want a quick fix. Yeah. So you kind of wonder why these guys stay in business.
Bad stuff. You know,
So-
it's a lot. It's a lot. People want to hear what they want to hear, and so they're going to believe the hype, right? Oh, I regrew all my hair in 3 months.
right.
Yes.
Right. And I always say this, Dr. Wasserbauer, if, especially the stuff that you see online, there's all kinds of ebooks. I mean, these guys are just, they're making money hand over fist. If these guys really had the cure for hair loss, they'd be on the cover of Time magazine.
They
And I
wouldn't
don't,
even advertise.
right. I don't know
Yeah.
why people can't understand that. I mean, I do know why, because we're desperate. We're vulnerable. We'll buy anything. We'll subscribe to anything just for hope.
Well, I've told that story, Spence. One of my buddies, and he's a fan of your show, and he knows better. He watches all the time. You know which one I'm talking about. I was sitting, we were having lunch, and he was telling me about how he found this amazing hair thing online. So he ordered something from Brazil, and it was some special oil and ointment. He paid $400 for it, and it turned out it was nothing but minoxidil.
Yeah.
And he paid $400 for the thing.
It's minoxidil being sold, online.
Yeah, with like berries and extracts and all this stuff. But it's minoxidil. And you look at the bottom, it says 5% minoxidil. And he goes, wow, but this thing is going to work. I know it. I was reading online.
It might work.
It might work. It might work because it has minoxidil. But I told him you could have gone to the store and bought Rogaine and saved a lot of money.
You could have gotten generic minoxidil for nothing.
For nothing, yeah.
Basically.
I think it's still that we have this thing where we think, well, no, it says that it's a new treatment, so maybe people don't know it yet. Maybe I'm the only one that came up, figured this out.
That. I love it when it's like the hair loss solution doctors don't want you to know about. What possible motivation would I have to keep people from growing their hair?
Yeah, it makes absolutely no sense. And I have the same issue, Dr. Wasserbauer. I have these guys online who there's some these conspiracy theorists who think that I just want to keep the money train going. That they don't seem to understand that if these technologies do come to fruition, I have even more opportunity to make even better living, because there's still going to be a need for what I do. No matter how great these products and services become, there's still going to be plenty of people who won't have the licensing to do this type of whatever's going to be coming to fruition, or just aren't actual physicians or whatever it is. They're still going to be trying to sell some crap to vulnerable hair loss sufferers. So I mean,
and there's a lot of different kinds of hair loss. No one solution is going to be a panacea. It's not going to fix everything, right? There is no magic bullet. As much as I would love for genetic modification to happen, that's still not going to cure all hair loss. There's a bunch of different kinds out there. So I know Spencer and I are not going out of business anytime soon, but the fact of the matter is we don't need to promote any particular thing in order to stay in this industry and do what we love, which is help people who have hair loss.
That's absolutely right. So Andrew, let me ask you a question. Am I sound any better now? By the way, yeah, Dr. Wasserbauer, we just actually have a new setup, a new rig in my studio. So we're just kind of testing it out with this new event. So if my sound seems a little wonky, I apologize, but I think it's...
No, I'm happy to be your guinea pig.
Thanks. I appreciate it. Now, I don't know if you're able to look at the feed or if Eric is, but I mean, we're able to get a really high quality, high def feed now, which I think is going to be great for these events, because people, listen, it's one thing, there are some doctors out there that are streaming some events. We were actually the first to ever stream a live, hair transplant surgery. I think it was 4 years ago with Dr. Alan Bauman. And there are other doctors now and, eye surgeons and stuff trying to stream live events. But I will tell you what's unique about what we're able to do with whoever wants to participate is this interaction. People want to be able to kind of there's a voyeuristic aspect of being in the studio with us and also being in the OR with you and having the ability to actually speak with you. And if Carlos is feeling up to it, to speak with Carlos as well. And I think that's, exciting about what we're doing right now, because, listen, this is a guy that's been through a lot. He's been through a lot. He's willing to share his life, and he's willing to share this, which is really, to me, a really intimate moment with thousands of online viewers. And once it's on demand, it could end up being hundreds of thousands of people who are going to view this video. So I think it's pretty brave of Carlos to do this for us.
And just to give you a sense of where we're at, we're about to Carlos has been kind of napping through this part. Obviously, he's not feeling anything. And when you're face down and it's dark, nap time. So
Zero one.
he's been kind of napping through the whole thing, and we're just finishing up right now. We knew we needed about 14 or 1,500 grafts. We've gotten that number. The site's already made, so our next step is to wake Carlos up and get him some lunch, put on a movie for him, and then start to place the individual grafts into the areas. And I think I showed you before, there's a scar, it's right behind May's hand here. There's a big area here and a big area here, and I'll send you those photos. We haven't downloaded them yet from our camera, but I'll send you the photos from this morning, and there's photos obviously on my website.
They're up there.
The old ones from this morning. Excellent. So those are up there. You can see him with his hair short, with his hair long, and you can kind of get a sense of what exactly we're trying to do here.
And I think that's great. And when you can have your staff send us the photos as well, we will post something both on the Bald Truth and on Bald Truth Talk, along with this video, so that people can kind of get an idea of exactly what Carlos has been through, and what his goals are, and what you guys think you're going to be able to do for him. I think it's important to be able to see that stuff. Now, are you guys taking any video besides what we're doing right now? Is there any video happening in the store?
Yeah, we took some video this morning when we first started, just so people could get a sense. Like I said, Carlos is really doing this a lot to pay it forward. So the people who are in his same situation can understand that there are alternatives to living with the back of your head not looking normal.
Sure.
So we have some of that, and we'll be putting that up. And other video, I mean, we're videotaping this as well. So I know you're recording it, but from a different angle, if people want to see, it'll all be up there.
Okay, great. And just you could have Lou, whoever, send us some footage too, so we can put some of that up as well. And guys, I guess you guys are about ready to go to lunch, right?
Well, Carlos, you want to wake up? How you doing? Yeah?
Yeah.
How's it feeling?
Not bad.
Not bad? That's always positive.
1-1.
Hey, Carlos, listen, I want to thank you for allowing us into this, like I told Dr. Wasserbauer, something I consider to be a very intimate event in your life. And, thank you so much for sharing this time with us. I think you've helped a lot of people. We're going to get your images up on the baldtruth.com, on Bald Truth Talk as well. And in time, when you feel up to it and when things start to grow in, I'd love to have you on my radio broadcast with Dr. Wasserbauer to kind of talk about your experience and to talk about the results.
Okay.
1-1.
Sounds good?
1-1.
All right, I'm going to lower it down.
3-3.
All right, guys.
Do
Go
any
ahead.
other patients have questions or call in questions for Carlos? Now that Carlos is awake and can answer some questions.
Any questions? Any questions in the chat, Andrew?
I think we went through most of them. We
Okay.
answered most.
All right.
Okay.
Listen, I think this has been a great event. I want to let Carlos relax and get some lunch. Dr. Wasserbauer, I really appreciate your time, and I think it's great that you're providing this service pro bono to Carlos, and I think that it really says a lot for you and for your practice. And guys, I want you to know that we will be, obviously this is going to be archived. You'll be able to see it on our site, thebaldtruth.com. You'll be able to see a link to it from Bald Truth Talk. I'm sure that Dr. Wasserbauer will have it embed on her site as well. You can check out and learn more about Dr. Wasserbauer by going to ihrs.org and checking out her IHRS profile. And of course, correct me if I get this wrong, Dr. Wasserbauer, it's CaliforniaHairSurgeon.com is your website, correct?
That is correct. Yeah,
Okay.
that's where we do the pro bono surgeries on non-celebrities.
That's great. Okay, well, I really appreciate your time, Andrew. Thank you so much for engineering the show as usual
Anytime, Spence.
and syndicating it, guys who are listening to the broadcast. Which is, I always find it interesting that guys are listening on like Ustream, Stitcher Radio to a live hair transplant surgery. But I guess the conversation is interesting to them. But if you're just listening and you want to see what's been going on, check us out on thebaldtruth.com. Until next time, I want to thank all of you for joining us, and I will see you on Tuesday's broadcast.